So I know you're nervous since this is your first time with Botox, but I like to go over just a couple little things. Botox comes actually as a powder form, and I actually have to reconstitute it. So I do a very specific ratio of a 1-to-1. So I take bacteriostatic saline, I mix it into the Botox, and out of that 100 units, I can draw out the amount that I think is appropriate for you. It will kick in typically the forehead 4 to 5 days, exactly, 5 to 7 around the eyes, and in here, which is your thinking or mean face, it takes about 7 to 10. So wait about the 2 weeks, and if there's any problems, just give us a call. We'll bring you in for a follow-up and we can take a look. And I know you're probably a little bit nervous because people talk about like it being a neurotoxin and a toxicity to Botox. It is formulated in a laboratory, and a toxic amount of Botox is 3,500 units, and typically we'll use anywhere from as small as about 20 units up to maybe 60 units. And I know you might be just a little bit nervous about a pain level, but I always like to show you that we use a tiny little diabetic needle, and only the tip typically goes in, so you don't feel much at all. You will have a little tiny red dots that will be on the skin for anywhere from 5 minutes up to maybe 30 minutes, depending on how your skin is, but they go away and there's no discomfort. And the last piece I always like to cover is post-care. Some people do complain of getting a slight headache when it starts to kick in because you're fighting that muscle movement. You can go ahead and take your normal aspirin or an NSAID, but the post instructions, I'm going to give this to you, but the big things we say are no laying down flat for 3 hours, no big exercise a day of your Botox, and don't apply your makeup, but make normal faces, and that's all you have to worry about. And the most important thing we tell all our clients, if you aren't sure about it or you have any questions about it, just send us a text message and we will get right back to you.